My name is Rachel Degood. I'm from Jonesboro, Arkansas. I'm currently in the Medical Scholars in Public Health program. I'm trying to obtain my MD MPH. I'm in my first year of the program on my second semester in public health. So, some similarities between the plague and COVID are that they were spread throughout travel routes. So the plague was spread throughout trade routes, while COVID could easily be spread from country to country by different transportation, such as things like airplanes, boats, and trains, other things. So they're both asymptomatic in certain cases, and both the plague and COVID led to different shortages. So during the plague, they had a shortage of wool. And during COVID, as everybody knows, we had a shortage of certain things, toilet paper being one of them. And there was also a shortage of medical supplies. So I worked during COVID, and certain supplies that we considered disposable, we had to hand wash and manually sanitize these just because we were not able to get any in stock to our facility. Both COVID and the plague are communicable diseases. So, some difference between the plague and COVID. First thing is their mode of transmission. So, COVID was easily transmitted by respiratory, so droplets, coughing, things like that, where the plague was typically thought to be transmitted by animals. That's a little debate. Another difference is that COVID was able to quickly have a vaccination solution, whereas the plague did not have a solution for a very long time before antibiotics were really available, and a lot of people died. So COVID was definitely fixed a little bit faster. Another difference is they talked about the rediscovery of areas. So the plague was so detrimental that it wiped out certain populations, and these areas, towns, were later rediscovered. While as COVID, we didn't really have this type of situation. Um, Another difference could be seen in the amount of people that died. So it's believed that COVID killed less people than the plague. It was less detrimental. And one source is COVID, the worst pandemic by FEHAN. They analyzed what the proposed death rates were and amounts for various pandemics that had gone on. And the years are a little bit different than the discussion board prompt, but in this estimate it says in 1346 to 1353. So the lower estimate that killed for the plague was 75 million. The upper estimate was 200 million. And then for COVID-19, this was the start of COVID-19 to 2021. The estimate for the lower estimate was 2.145 million, and the upper estimate was 100 million. So there was a difference in the amount of people that were killed. How could epidemiology be used to contain or eliminate? So by using things like spot mapping, seen by John Snow with the cholera outbreak, would be that you would be able to localize where you're having more infections, and if they were able to do this, they could try to reduce the risk because at the time they didn't know where it was coming from or what the cause of it was from. So if they were able to pinpoint it, it might have been a little bit easier to not eliminate but reduce the rates of illness and reduce the death toll. And another thing would be analysis. So if they had analysis techniques similar to ones like William Fair did, it would help them to measure risk factors, or at least attempt to. And with that, you can't really, since they didn't have a lot of modern medicine, they didn't have antibiotics to solve the issue. These could be used to help try to reduce the death rates, but not necessarily eliminate or entirely prevent the issue.